welcome to studying Joseph Smith's life and image. We talk about a lot of different things. So today is going to be different. We're going to go over one study on masks. We're gonna dive into it. So, basically, questions: can masks protect you from COVID-19 or the variants? Right? Can masks protect others from your spit, sickness, illness, COVID when you wear a mask, right? And then can two people wearing a mask standing 6 feet apart transmit COVID-19 or its other variants or the flu or whatever? So if you feel that this will upset you and you still want to watch it, and hear my take on this research, just play some church music. Take really deep breaths. Let's dive into it all. Started with don't need them at all. If you have COVID, wear a mask. But if you don't have it, you're not diagnosed, you're fine. That's what the WHO did. So prior to this, they said we didn't need it at all. But I did hear around February that our prophet, President Nelson, had sent masks to China and PPE and like all of that stuff they were running out. And he has a lot of friends there and he has connections, loves the people there, did work there, and he can speak the language, you guys. He can speak various Chinese languages that they speak, or at least one of them. Anyway, I don't know much about the Chinese language, but he can, which is very impressive and amazing about our prophet. And I think he can speak Spanish. Like, he's a really smart guy. I know I was scared and watching people in China. They were wearing masks and covering goggles. Some people, just really over the top. And it just seemed over the top, right? One thing to keep in mind is they had horrible pollution there. So they wore masks a lot just because the air was awful. But that might have contributed to the high death rate, just the damage to the lungs. Like I heard of a healthy man, I think from Utah, that was a firefighter, but he was healthy. But you're breathing in a lot of toxic smoke. It's not just firewood burning, it's buildings and things you shouldn't be breathing in. Firefighters go through a lot. It's very toxic. People with chronic illnesses, and anyone that just had anything wrong with their lungs, asthma, were becoming hospitalized and not doing well. So these were non-able-bodied, and even people that seemed able-bodied, right? This firefighter, everyone thought he was healthy. But the effectiveness of masks, it's been tested for decades. But I will go over into one study from late 2020. It was done in Japan. And so keep in mind, it's being translated from Japanese into English. Okay, and it is titled as Effectiveness of Face Masks in Preventing Airborne Transmission of SARS-CoV-2. SARS-CoV-2. I just want to make sure I say it correctly. And so what they did with this test is they set up two dummies about 1.5 feet away from each other. And no, this is not 6 feet apart. None of this test is. So they were, for most of it, about 120 centimeters apart, specifically. And having read the scientific journal a few times, it seems that they were focused on the ability of masks to protect healthcare professionals, who will often be barely a foot away from your face, not 6 feet. And usually you talk to people, you're 2 to 3, 4 feet away from people talking to them in normal day-to-day life, unless you're family, hugging or whatever, your mother checking your child, right? Doctors have to be that close listening to your lungs. These professionals have to swab you, so you can't be wearing a mask, right? Or, but yeah, and then they may be masked and you'll be not. So it is more focused in the whole conversation mostly is about health professionals. Can masks protect them from a patient for the most part? But they go into both. I'll just read it. And they use various rates, various amounts of this solution of COVID-19. I'll just read it and we can all try to understand it. I'm not a healthcare professional. I'm a certified medical assistant. This is not me giving you medical advice. And I'm not a scientist just a CMA. But just looking at the pictures on figure 1A, both dummies have masks. The spreader has a mask sealed with adhesive tape with a nebulizer and a tubing attached to mimic a normal cough. And the receiver dummy is hooked up to an artificial ventilator set 25, 50, then 100 centimeters apart. That is approximately like 3 feet away from each other, like the average distance of people talking to one another, but not the recommended 6 feet apart. Figure 1B, we have the spreader now hooked up with the nebulizer filled with basically COVID-19 fluid to dispense a mist. And the masked, because they really want to know that specific virus, how does it react with these masks? And the masked receiver hooked up to a ventilator to, like generally normal rate to breathe in, breathing out, breathing in, right? Next, we see the images, both dummies not wearing masks in figure 2A, then the receiver only wearing a mask, figure 2B, the spreader only wearing a mask, figure 2C, both spreader and receiver wearing a mask, figure 2D, E. These were done at a rate of 5 times 10 to the power of 5 PFU. Figure 2F was 1 times 210 to the power of 8 PFU. This image, they were testing only the receiver with a mask. Cotton masks, surgical masks, N95 masks, and N95 fit masks where they taped the mask around, sealed it. 2G again is showing only the receiver wearing the mask. So the spreader's not even 2 feet away, not wearing a mask. 2G is again the spreader unmasks, the receiver wearing a mask, but specifically only N95 masks. 2H again is the spreader unmasked, receiver masked, and I is the same. So understand 6 of the images in the study, 6 of the tests were testing the effectiveness of only the receiver wearing a mask, testing the effectiveness of protecting them from a non-mask wearing dummy less than 2 feet away. The wording you will find in their conclusions are again focused on healthcare providers who are treating patients that cannot wear a mask because they might be fitting them from respirator, they might be swabbing them to test them or for COVID or for strep, what have you. This test finds the best way to prevent COVID-19 is for both dummies wear a mask. Basically, this does not test the effectiveness of both dummies wearing masks 6 feet away from each other, probably knowing the results will be pointless because it wouldn't spread. It would not have been transmitted. That is what I've heard from professionals, that basically if both individuals wear masks and stand 6 feet away, you're well protected for the study. But again, this is more for professionals that are in probably the worst situation. But anyway, here are the quotes from the study. And we'll all try to, you can just read it yourself and try to understand it. But so they state viral loads in the inhalation droplets aerosols were inversely proportional to the distance between the virus spreader and the virus receiver. However, infectious virus was detected even 1 meter away, figure 2A. So basically, they found at various distances up to 1 meter away, the virus spreader infected the receiver, both not wearing a mask. And this is how most people get the common cold. We are always breathing air and bacteria we unconsciously breathe into. And note, many previous studies have actually shown droplets can travel 20 feet away. Like if you sneeze, like there's a cough and then there's a sneeze, you know. And I learned that in 2015, 2016 when I went back to school to become CMA. But they also stated, figure 2B, the N95 mask had the highest protective efficacy, approximately 80 to 90% reduction of the various masks examined. So obviously it's the best. And this is, 2020. I've heard that for 4 years, right? However, infectious virus penetration was measurable, even when the N95 mask was completely fitted to the face with adhesive tape, figure 2B. So in contrast, when a mask was attached to the mannequin that released the virus, cotton and surgical masks blocked more than 50% of the virus transmission, whereas the N95 mask showed considerable protective efficacy. As they continue on, talking about figure 2C, when a mask was attached to the mannequin that released the virus, the cotton and surgical mask blocked more than 50% of the virus transmission, whereas the N95 mask showed considerable protective efficacy. So if you're sick and you're wearing an N95 mask, you could probably stand 6 feet away from grandma and be in the same room. There's still a possibility someone will get out, right? And then we got figure 2D and E. And they state there is a synergistic effect when both virus receiver and virus spreader wore masks. cotton mask or surgical masks, either one, to prevent the transmission of ineffective droplets aerosols. But then they decided to increase the concentration of the infection in the nebulizer of the virus spreader, and they have an interesting statement at the end about that, like maybe we shouldn't have done that. But anyway, spoiler, but going on, they said we next tested the protective efficacy of masks, and these are like worst case scenarios. You understand? It is. We next tested the protective efficacy of masks when the amount of exhaled virus was increased. The viral load was augmented to 108 PFU and exhaled by the spreader. Then the uptake of the virus droplets aerosols was measured when various types of masks were attached to the receiver. So again, they're focused on only the receivering mask, because that's the bad situation healthcare providers were in. I mean, they care about us, but they, we're all going to die if they die, right? It's kind of like help yourself first before you help other people. As with the loral viral load, 5 times 105 PFU shown in figure 2b, the N95 mask sealed with adhesive tape showed approximately 90% protective efficacy. See figure 2F and G for a comparison of 2 N95 products. I'm still quoting. When the amount of exhaled virus was reduced to 105 PFU or 104 PFU, infectious viruses were not detected, even in the samples of the unmasked receiver. So at a smaller rate, it was like, well, I mean, the mask does protect you, right? They're checking this every which way. Viral RNA was detected in all samples. However, due to the quantitative decrease, when they lowered it, there was no difference in protective efficacy among all the masks, including the sealed N95 masks. If you conclude that to mean none of them work, that you're not understanding what they're saying. That's all. Not that I understand all of it perfectly, but that is not what they're saying. So they continue on. In contrast, when a mask was attached to the mannequin that released the virus, the spreader, right? Cotton and surgical masks blocked more than 50% of the virus transmission, whereas the N95 mask showed considerable efficacy. So yeah, some is still coming out of it. Their conclusion noted, our airborne simulation experience showed that cotton masks, surgical masks, and N95 masks had a protective effect with respect to the transmission of ineffective droplets aerosols, that the protective efficacy was higher when masks were worn by the virus spreader, right? It's really important that whoever is sick is wearing a mask, right? So if you don't want to get others sick, like you, wearing a mask is very effective. They continue. Medical masks, surgical masks, and even N95 masks were not able to completely block the transmission of virus droplets aerosols, even when fully sealed under the conditions we tested. It doesn't mean they're ineffective, though. Meaning a healthcare professional caring for someone else, they need to take the mask off of that patient. They're not protected, even if they're wearing an N95 mask. Like, it could still get in, and that's why hazmat suits are needed. Like the Ebola, remember that came out a decade or so ago, and there were a couple cases in the U.S. that even wearing a hazmat suit, one woman got it and got so sick almost died. It's very scary because she just accidentally touched her face, but that wasn't an airborne. But even with airborne, like for these healthcare professionals to be protected from you, you're laying in a bed, they're gonna need to take your mask off. You're gonna need to, even for a minute or a second, whatever. They're seeing how can they don't say this, but they basically need a hazmat suit, okay? Unless you live in a fantasy land of the TV show like Grey's Anatomy, and they all have a hazmat suit, right? They continue to allow quantification. We conducted our studies by using relatively high dose of virus, and under these conditions, it is possible that the protective capacity of the masks were exceeded. Although the efficacy of testing infectious virus was reduced when the amount of exhaled virus was reduced, viral RNA was detected regardless of the type of mask used. Obviously, air is supposed to get out of a mask, you guys know. However, it remains unknown whether the small amount of the virus was able to pass through the N95 masks would result in illness. So basically, all masks tested did not prevent the virus from escaping to a small degree. And they state further testing will be required to reveal the precise relationship between the protective efficacy of masks and the components of viral droplets aerosols. Our data will help medical workers. They're focused on that, you guys, because most of these tests are showing the virus spreader not wearing a mask and the receiver wearing one, which is usually going to be the medical worker. That's really what they're focused on. So they're trying to help medical workers, they state, understand the proper use and performance of masks, the importance of fit-in masks and avoiding their reuse, which unfortunately they had to do, and to determine whether they need to additional protective equipment, e.g. a negative pressure room or positive pressure mask to protect themselves from infected patients. And so me, in fall of 2021, I'm in a family ward. We've all been asked to wear masks again. And I'm sitting in the back, and it appears everyone has complied. Like, everyone's wearing a mask. Not a mandate, maybe for bishops, I don't know. I wasn't that close to any bishops to know what they were told, but he basically asked us to do this. And I could see a young man, maybe 23, intentionally coughing for a few minutes. And I'm an actress. I can read people, and I can tell when someone is lying, fake crying, fake laughing, fake coughing. I've seen a lot these past 3 years, you guys. Sitting in front of him is an elderly woman, elderly wife, a daughter of lupus, and another daughter that's confined to a wheelchair. Like, you are very immunocompromised if you were just stuck in a wheelchair, no matter what put you there. And I see this man, he starts to rock back and forth. And he just keeps coughing. It was more like a with a than really a cough. Like, it just wasn't normal. He wasn't really, he didn't look sick to me, but who knows? I don't want to, they've made videos where nurses were making fun of someone for coughing. They think they were faking, but I think he was faking. And eventually he just rips that mask off, leans forward, and and just does all these coughs without his mask on. So he's less than 50 centimeters away. I mean, I wasn't close enough with a measuring stick, but he's close, leaning forward to this immunocompromised family. Like, everyone in the family was immunocompromised. And I got up and left. If I didn't, I was going to go over there and talk to him, have a little conversation with this dude, but I chose to walk away. But the next week, I was wearing a mask. He wasn't. Most of the ward wasn't. The next week, I was in Arizona. And later, he did the fake coughing thing again, and I could hear him laughing. And quietly, I just said, "Wow, you're so cool." And I just ignored him. Didn't say anything else. I did not. I don't like contention. I really, really don't. So if this young man had COVID from this study they found, he would have transmitted it to this family for sure. And I knew of one death that happened in the ward not long after this. A father of the ward got COVID and he died. And not long after this, new mandate, a bishop that I knew growing up, went to that family, that ward all the time. It was just the first person I knew. He died. He was a doctor. He and his wife both just died really quick from COVID. And if it was something else, like, the family would have said, "Oh no, it wasn't really COVID. He really was this," but they got it. Like, they were weird. It just he really had COVID. But I confided in my ministering companion, who knew this young man though, and probably should not have. And I said, "Don't tell anyone." But I think she did, because almost immediately the next week, his wife was giving me seething glares and just really angry. And then her friends were going to literally great lengths to turn around, stare, glare, mock, laugh at me while the sacrament was being passed, like, really irreverent. It was just like, this is too much. And so I texted that ministering sister asking, again, like, don't tell her, don't tell anyone what I told you. And, the whole point was I wanted to avoid that family, basically. And she replied that she had requested that we not be assigned as companions anymore. And this bullying really caused me deep depression, and it was not fun. I began visiting a different ward, trying to move soon after, which ended up in a really nightmare beyond nightmares. I'm not going into that situation. You can always think life cannot get harder, and guess what? It does. We just need to understand that President Nelson is coming from when he thought nothing of asking us to wear masks after many were happy to be free of the mandate. When, for example, in the state of Arizona, you didn't need to wear a mask in the summer of 2021 if you'd gotten the vaccine. And I waited a while to get the vaccine, so I kept wearing a mask. And a lot of people being like, what are you like seriously afraid of this? And I responded, having known about this study and a lot of other things, I said, well, the mask is really only mostly effective if the sick person is wearing it. And I haven't gotten the jab yet, so I'm really protecting you from me. And just kind of this shocked expression. I'm like, this is really me being compassionate towards you, because I haven't gotten the vaccine, right? So our prophet, Russell M. Nelson, he wore masks as a heart surgeon. According to Google, the average heart surgery is 3 to 6 hours long. And think of how many he did a day. He's always wearing a mask. That's his life. You want to talk about being inconvenienced. Imagine not being able to rub your nose for 6 hours, not being able to sit down, but standing in the same position, holding someone's literal life in your hands. That is his unique perspective. And again, like, this study did not find that masks are ineffective whatsoever, even though for decades they're important and needed in surgery. So anyone mocking people wearing with a mask don't work, the truth is the opposite. Yes, only hazmat suit really 100% protects you from the virus or people from you. But the reason Nelson wore surgical masks is the fact that your cardiac cavity is supposed to be sterile. Any amount of spit coming from Nelson's mouth, sick or not, nose, would cause a major infection and quick death. And you don't have to be, he doesn't have to be sick. You know, your mouth and nose always contain high amounts of bacteria. Just listen to any one of the videos of famous Dr. Mike on YouTube. I really like him. He's funny. He's from Russia. And
the human mouth is absolutely dirty with bacteria.
Russians are funny people. And he always brings this, I think because they've been through so, like, just the people. There's a lot of really good people from there. They've been through so much. They have to laugh. They have to, those that I met. Anyway, despite us brushing our teeth, and even if you're not sick, my mouth's full of bacteria. And so Nelson is known for years the effectiveness of him wearing a mask, protecting the patient on that surgical table from the bacteria in his nose and mouth. Otherwise, surgeons wouldn't wear them if they didn't work, right? You just have to be very, very careful. If you're a surgeon, very much aware of germs. You were very aware of that, right? But me personally, I have a lot of health problems. I know it's not like the worst of anyone I know, but since I was a teen, I've been diagnosed with Ehlers-Danlos syndrome, postural orthostatic tachycardia syndrome, and asthma. In my early 30s, I had my first surgery, an appendectomy. It was late, no thanks to an ER refusing me a scan. Horrifyingly, I was prescribed an urgent care hydrocodone anti-nausea meds, I was throwing up, and the urgent care, even more horrifyingly, I've never been on any of this stuff. They hooked me up on a morphine drip. All before being rejected at a big hospital before going over there, because they came and yelled at me and said, go take her to the ER right now, because I was in so much pain. They couldn't touch me this way. They put me on a morphine drip. They shouldn't have done that. The ER doctor at the big hospital diagnosed me with gastritis without doing an endoscopy, without even touching me, refused me a CT scan. I now realize, because he thought I was a drug seeker, because they did a blood test and they saw that I had morphine in my system. Seeing the pain meds, despite two guys that were with me, and me telling, I clearly remember this, like, did you get any pain? They said that you got pain meds. I'm like, yes, because I was in so much pain, but please do a CT scan. Because they didn't ultrasound, it all came out black, and the guy didn't use gel. Like, so many things were done wrong, and I've talked to ultrasound techs, like, they're like, if you don't use gel, it comes out black. That's why I didn't see anything. Because sometimes you can see a bursting appendix on ultrasound, but they didn't. And he just looking at me, you've got gastritis, I'm going to give you Carafate and prescribe you Carafate, and my insurance won't cover it. It cost me $100 that night. But it's for stomach ulcers. They only diagnosed that with an endoscopy, but I didn't get one. So I spent $200. Pain meds, anti-nausea meds. antibiotics, and carafate. And obviously, spoiler, being misdiagnosed. Ultimately, this was all wrong. Trying to juggle all these medications, I believe this doctor in the ER, that I was very severely painful gastritis, so I needed hydrocodone. Told me to take it, so I did. They needed the anti-nausea meds for cancer patients, and I needed the hydrocodone. I needed the carafate and antibiotics. My blood had been taken in the ER as well, and they saw there was a high white blood cell count. And I remember coming home and feeling my pain migrate from the center of my stomach to the lower right. Barely felt it. And the spirit telling me to look up appendicitis. And I grew up watching Digger Hauser and knowing that was like how you became a doctor and like you feel pain in the lower right. And I was always scared of that growing up. Like we all know about appendicitis. So I go to the ER again. I had to wait a while for my roommate to come home. She kept telling me I was probably constipated. And eventually she's like, oh, okay, fine, I'll come home and take you to the ER. Because I couldn't drive myself. I was high. Thanks to the urgent care. Texting my brand new roommate. Yeah, we double checking that. And so while we're in the she takes me to a really small hospital. I went to a big hospital. I was given a CT because the spirit's like, ask for the CT, tell them you think it's appendicitis, just give me that CT, please, people. And because the big hospital, like, well, we'll just save you the radiation. We won't give you that CT scan, even though our tech has no idea how to use an ultrasound machine. The hydrocodone wore off. It was the worst pain of my life. I'm writhing in pain. I am screaming. And it just feels like someone's stabbing me with a hot knife. Real pleasant. And he yells at me and says, we know you're in pain. Stop hitting the call button. And I don't have any more memory at all of pushing the call button. I think I was in too much pain to even think, I need to push. I'd never been in a hospital. I didn't know there was a call button. I have a theory that my roommate was a little bit scared. This brand new girl that I'd only known like a week. And per my roommate, this is like sort of quoting, he said that he was going to teach me a lesson. I don't remember that because I was already probably going to teach you a lesson. And he, according to my medical records, he double dosed me on Dilaudid while hardly being able to keep my head up. The staff came in. I vaguely remember meeting a doctor, maybe being handed a pen and paper and just told to sign. And no, forcing someone to sign off on a surgery while they are unable to hold a pen or think and they're getting knocked out. It's not legal. I remember telling them that I read online. I really did find this before I asked, as I'm waiting for my roommate to decide that I'm not just constipated taking the ER. It said that it's best to actually give people antibiotics and then do the surgery because there's a lot of rates of sometimes having an infection after. I think the spirit was telling me. The spirit was guiding me, you guys. And that's why I'm telling you this story. And it is important, just please listen. The Dilaudid completely knocked me out, right? Again, per my roommate, the doctor is yelling at the staff for ODing me and will lead me into surgery anyway. I wake up the surgeon standing over me saying, I didn't think you were going to wake up. I've been waiting for 8 hours. Your appendix was black. It was dead. There was pus. So we're sucking pus out of you with a drain tube. So I have an infection. And I ask where my appendix was. I wanted to see it. Note, I've never had any surgeries before. So I'm remembering as kids, wisdom teeth out, tonsils out. I've only heard of kiddos getting their tonsils and whatnot and getting to see it and see pictures. And they said they sent it all home with my sister. And I tell them it was my roommate. That also is illegal, you guys. Just letting you know, I've taken medical law and ethics. I hardly knew her. She's just someone I barely met that drove me there. Anyway, I listen to the spirit again and tells me to ask for antibiotics. And the nurse said I already had some. I was done. I was good. I didn't need any more. And I argued because the spirit was like, no, ask again. My mom, who's an RN since the 1960s, shows up in late 1960s. We began asking questions, and then throughout, the 90s and 2000s, she worked really long, almost 40 years, right? She knows a lot, actually. She's very, very smart. She begins asking for tests to make sure I don't need antibiotics. It was gangrene, black fecal lith. You took it from here and took it out of her belly button, where we weren't really thinking that. We were all, my mom was tired, I was tired, but we did our best. We asked for tests. And then my mom asked for the drain tube to be tested. Again, she's smart. She knows her stuff. But the nurses say, I even recorded it because I was in shock. Or my mom asked me to, I don't remember. But I have it recorded. This nurse apparently, allegedly, states the doctor doesn't believe in antibiotics. And we speak to the doctor, and he says that if I'd had more pus coming out of me, like a man he'd seen in Chandler, maybe he'd give me antibiotics. And this is 11 years ago. But not for my micro-perforated appendix. He kept getting angry, very high Debbie for saying it was burst, saying it just leaked. It was just micro-perforated. Stop saying it burst. He's like arguing with me. And I didn't see why I couldn't say that. And I recorded this conversation and asked for a urine test, asked for a blood test. I'm like, find a reason, give me antibiotics. I know the Lord is telling me to ask for this. And later my mother asked that the culture and the contents of the drain tube and the surgeon, in the conversation anyway, I'd been given Cipro and it was in my bag, but like from the urgent care. And he said, just take that, that'll kill it all. And that's just how he ended the conversation. I'm like, oh, okay. And then what occurred was a continual nightmare. The second day, a nurse came in with scissors in hand, saying she was going to take out my drain tube, and I tell her I am due for pain meds. I was in severe pain, level 10. I didn't want her to do this. She refuses to give me another hydrocodone pill. And because the Dilaudid, they found even after they double dosed me, I almost stopped breathing post-op. So like, no Dilaudid for this girl. Just maybe give her a low-dose pill. And anyway, she refused my request to wait. And before taking my drain tube, and she said that her shift was ending. And she shoved my hands out all the way and quickly just cut the little sutures. It was sutured in and ripped, and it was stuck. The drain tube was really stuck. And I remember her just finally getting it out, treating me like cattle and throwing it in the trash. And I've developed OCD in my 20s. I'm in my 30 at this point. And I've noticed every nurse needed to be told to sanitize or wash their hands before touching me. And they were really annoyed, to say the least. This one woman did not wash her hands from what I remember. She almost ignored every request I gave. And know that what she did, even the fact of just touching me without my consent, would be classed as assault. So again, education, you guys. If they do that, you can call the cops and get them handcuffed. I've gone through medical on ethics, and I floored my teacher telling the story and was told you should have called the cops. And right and then and there, but instead, I just sat there crying and knowing I just got really depressed. No tests were done whatsoever. No IV bags of antibiotics were given. No prescription was written by anyone in that hospital. And I went through some of the worst pain following my appendectomy. I had severe backup that caused me screaming pain in the bathroom. I think I have EDS, and I think I should have actually gone to the ER and gotten that fixed, but I didn't because I have EDS, and I was able to. Anyway, it was almost as painful as my appendix bursting. And 2 weeks later, I saw fluid coming from my 2 centimeter. But every time I went to the bathroom, I was screaming and screaming until it finally was done. But it was so painful. 2 weeks, I saw a little bit of fluid coming from my 2 centimeter incision at my belly button. And I'd felt the Spirit tell me to put a bit of gauze on it before I go to church. And I did. And after church, as I'm cooking, a lot of fluid came out. And I was like, oh my goodness. And it did not smell good. It was really gross. And I remember calling my guy friend, who's a doctor of osteopathy, DO, and telling him, just a friend, like my same age, that I likely just, he said, you probably just got an abscess. It happens. And after a lot of drama had happened with my brand new roommates over me not cleaning enough. Like I left something in the dryer. Like they got really, really mad at me over stupid stuff like that. And you're not supposed to lift anything for another 2, 3, or 4 weeks. My mom was cleaning. It was just ridiculous. But anyway, my mean roommate overheard me talking about pus coming out of me. And she just says, ew, gross. So I drove myself to the ER after weighing the pros and cons with my friend of going back to the small hospital, but the big hospital refused me. I'm like, who's going to help me? I don't know if I trust the big hospital or the small hospital. He's like, the small hospital has your medical records. You need help right now. They'll be able to treat you really quick. So I went back to to the small hospital, and he said it. My experience back there at the small hospital was way worse this time. The nurse in the ER refused, whereas they were annoyed. They refused to wash their hands, and several refused, walked out, and I recorded the next nurse. I was just like, Like after the third nurse refused to wash their hands before putting an IV in my arm, I recorded that. And she just said, well, it just depends on we just wash our hands after we see each patient. But you touch a million things, you guys. And I'm going to put in a little clip of a girl that also has Ehlers-Danlos syndrome, has had a ton of surgeries. She got really septic, really bad. In the same situation, she was like, please wash your hands. And the nurse was like, oh, no, it's fine. I didn't touch anything. She ran out of the room and she touched stuff. She touched the paperwork. The girl got sepsis immediately, like really quick, and had to be hospitalized. I'm going to put a little bit of that in just so you know. And if you're in the medical field, do what you're supposed to. Okay. Sometimes you get sick anyway, but like, I'll just go on my story. I got another CT scan, and what they found was 3 abscesses. One had burst, you guys. And so the fluid coming out was that. And then 2 others deep inside under organs, just really bad. But I thank Heavenly Father for inspiring me to put gauze over my incision before all this happened. And I needed surgery. They said, you need surgery. And then all of my friends that showed up, and I felt like I was doing so well, better than I'd ever been in my life socially, there in Gilbert, Arizona, 10 years ago. But they all left the moment they said, don't do that. That doesn't mean we're doing surgery right now, because it was another 24 hours later. You guys just don't, they need you. And I just was even more scared being alone. But anyway, I was operated on a day later. But before this, my surgeon, same guy who didn't believe in antibiotics, was trying to pawn me off to a tech to aspirate the abscesses while I'm awake, and like, kind of like when you get a colonoscopy, you're not knocked out, is what they were telling me. And so I remember them bringing in a wheelchair, and I was feeling myself, I wasn't able to move. Something wouldn't let me move. And I just kept trying. I was also just terrified. I was just like, this really scares me. How they're describing this really, really scares me. I don't want to do this. And the surgeons yell at me like, just get in the wheelchair and we'll have the tech just do this. And then the surgeon comes in angry, saying that he talked to the tech, and then they refused to do it. And he's, now we're going to do a huge incision. That was his words. I bet the tech had said the abscesses were too deep inside of me. He thinks it's too dangerous, but I think he should just do it. Like, it was awful how the guy was treating me and talking to me. But if I'd gone in, no doubt, like, they would, a straight needle. When abscess was deep in my pelvis underneath my uterus, he couldn't just know. And me being awake, like, really? They only do that if it's superficial, you guys. When I looked that up, I'm like, what? This surgeon has a lot of different ideas of stuff. I don't think he's your average surgeon. I'll tell you that. And at this point, I'd been eating nothing but ice chips, no water, which makes sense. That's standard before surgery, right? I remember being wheeled in and asked questions, backtracking before the surgery, actually. Right before the surgery, they were like asking about my health, if I drank, if I did drugs, if I smoked, and I was like, no. I just remember crying, being like, no, I take really good care of my body, and I just keep crying and crying, because I do. I've never broken the word of wisdom, still haven't, and I kept crying, and the surgeon got so angry, yelling at me, and said, well, we don't have to do this then, if you're going to keep crying. And me, I just said, we have to. I know I have to do this. I don't want to die. I have all these abscesses. One is burst. This is bad. I know I have to have surgery. I'm just terrified because my mom is gone. I have no family. I'm not from Gilbert, Arizona. I did make a lot of friends. I thought, the best time of my life, to be honest, in the best shape physically I'd ever been in my life. Eating healthy. I've never been anorexic, but not to be arrogant. But then, the anesthesiologist said, we'll just give you something to calm me down. I was just out. And then I wake up to burning pain. I just felt burning heat. My stomach muscles were just like this. And I'm just like, crying and just seething in pain again. And someone yelling, give her something. Well, she doesn't have a prescription for morphine for another hour. which isn't prescription for morphine. And I remember them saying like it was an hour, but they gave me Tortal, which is basically Tylenol. And then after an hour, I got morphine, and they don't give you that long after you. That were actually very, very nice. And she told me that I needed to start walking, and I needed to go to the bathroom. I actually think, anyway, that they were gonna help me, but I needed to learn how to do it on my own though, because it was a small hospital, and it was really painful because it was a vertical incision from my belly button straight down several inches, and staples. Very painful. You use your stomach muscles you don't realize until you have surgery how much you use your stomach muscles to sit up, to get up. But I was walking around the hospital every day. My mom would call from Oregon and asked if the cultural results were back yet. And every day she was told no. Just spoiler, it was from Sunday to Saturday I was there. But every day I was forced to walk around the hospital. And every day I was just eating ice chips. Nothing but ice chips after surgery too. And I felt inspired to ask for ice pack because I was in so much pain from getting up, walking, having to sit up myself. It hurt a lot, you guys. And it was a lifesaver. Ice packs just help. Ice helps. And I think that it might be an EDS thing, but anyway. My room got really, really cold after I started asking for that one night, and I asked the nurses if they could turn the heat up in my room because I don't know how to work it, And they told me it was broken, and they couldn't turn it up. And I remember I walked out of my room right in the hallway. It was warmer than my room. Every single room, and it was a small hospital. There were like nobody there but me. Like maybe one or two other people. I think they told me once there were 6 people there in the whole hospital. The first surgery, I don't remember. I didn't ask that the second time, but I didn't see people in these other rooms. They were empty. And I walked into that room and like, wow, it's so much warmer. It just was. Like, I guess the heater broke in my room. And while I was in there, I hear this female nurse talk to a male nurse and said, why don't you just go in there and warm her up? And they start cackling. And I walk out. I think they just think that we just don't get anything. We're all brain dead. And like when you're on pain meds, you're not. And I walked out and I said, that was not funny. And move me into this room. It's warmer. Please, A little bit of trauma there midweek, or day, maybe the second day. It might have been the first day. I just don't know. But I was told I could not have Dilaudid after the first surgery. I remember my mom saying that because I almost stopped breathing. So I remember asking to get Total on my IV after, because they were sort of like, you have options. I'm like, oh, just do Total. And I'm like, that helps. It helped me more than getting oral hydrocodone. And I wasn't high at all. I think that's why they didn't realize I was so quick being like, I heard that. You do not make sexual innuendos about me alone with no family. That was really scary. And then I was on quite a cocktail of antibiotics, antifungals. And again, I wasn't high because I was getting Total. And anyway, it was making my veins burst. And I also know I was not at all aware that I had Ehlers-Danlos syndrome at the time, which we have fragile connective tissue, which includes your veins and all your internal organs. But that probably had something to do with it. And a nurse was running out of options and places to stab me. I remember they stabbed me in my hand. I know I'm going into such detail, but like, this was not fun. Being in the hospital of major infections is not fun. And then he was scared of me. I was like, oh, that hurts. Please take that out. I was like, please take it out. And he's like, you're going to poke me. And like, he ran out of the room. The people that were making sexual innuendos about me treated me real well. And I didn't have an IV in for a little bit. I remember that was like midweek, full on panic attack after he yelled at me. I just couldn't. I hadn't eaten. It was like Wednesday or Thursday. I hadn't eaten since Sunday. But then they also started giving me Dilaudid. I would be on the phone with my friend Daniel or my mom, and I would just suddenly drop my phone and not be able to. I'd go catatonic on Dilaudid. Not exaggerating at all. I couldn't move. And then they were yelling at me for not walking to the hospital because I was like catatonic, and they were mad at me. My mom, the RN, began asking me if I'd had anything to eat. I don't remember at one point that was, and by now I'd been over 4 days. I remember when that happened. And I just had ice chips. And my mom was shocked. And she said, well, I'm like, ask them if you're getting TPN then. If you're not able to eat for 4 days, that's too long. That is too long. And he says, I've banana back. She's like, well, that's TPN. I'm an RN. She's worked in an ER. She knows. And she tells me to read the bag. It really was literally, since Sunday, I'd had a saline bag with trace amounts of glucose. So obviously I'm having a panic attack. And they're making me walk around. So backtracking, you guys. When I was admitted before surgery, I did speak to some administrative woman. I was almost taken to another hospital after I told them how upset I was with how the first experience went. But the surgeon said it would take a really long time, and I had an infection, so he was really discouraging me from. And I talked to a woman, and that I just told her everything that went wrong. And one of the things that I was realizing during that 2 weeks was the screaming pain for a week slowed, like my digestive tract just didn't work. And I was like, they should have given me fluids first and soft food instead of, they gave me solid food the first day, like meals. And things weren't moving. They shouldn't do that until they know things are moving. You should get applesauce, juice, right? I hadn't even gotten that yet this time around, right? But this is before the second surgery, so I'm backtracking. And again, the surgeon said, even in that first conversation, that first week, he was like, oh yeah, your intestines were kind of blown up, and he was worried about it. And I remember the only thing he diagnosed was pain. He didn't want to give me antibiotics. He didn't believe in them. Pain meds and like a med to try to help things to move. So basically, I said I really should have gotten soft foods and fluids first, like just juice, and maybe I wouldn't have been in screaming pain for a week. And she leaves. And then another woman just immediately walks in, and she is raging, yelling at me here in this small hospital in Gilbert, Arizona, about how I gave you food. And then I start to tell her, I'm like, I have a major infection. I have a hole from the deep inside of my body coming out, and I'm really scared, and I should have just been given soft food first instead of solid. She didn't understand. She was just raging, wanted to yell at me. And she runs out, doesn't say anything. So I should have been transferred to a different hospital, you guys. And I should have died. I could have died, sorry. It wasn't my time to go. The Spirit had told me that. But I'll try to shorten this, especially because, I was drugged another day, and my mom just started telling the nurses, like, get my daughter off of Dilaudid. She almost stopped breathing. Like, you could cause her brain damage. Really, really, that is a toxic reaction to medication. So if you're going completely catatonic, can't move, can't walk, you shouldn't be on that medication. Like, they do that when you have surgery, right? That's not all day, right? Think about it. And they were telling my mom they couldn't tell her all of a sudden. Well, we can't tell anything because she's like, they were sick of her asking every day, did you get the culture results back? I'm just spoiler. They did not run it stat. They did not run the culture results stat. Know that. Anyway, and then I just lost it. I just was like, do not give me Dilaudid. I'm like, you are fired. This one was really mean to me. And she was like smiling as she gave me that. I was like, no, don't you talk to my mom that way. I don't want you touching me again. I shouldn't be getting this medication. But it was really, really scary. And I was always still having to ask them to wash their hands before they do that, because that is how, I should show that video of a girl. She was just getting something injected in her IV, and that woman didn't change her gloves and sanitize her hands, and the girl got septic. It's very dangerous. I asked, my culture results were back again. Thursday, Friday, no. And they started to give me juice. I think, according to looking from Instagram, I did start taking pictures and posting them on Instagram. That was the only way I knew what was going on. And I said, first bit of food since Sunday was some grape juice. Threw it up. And I couldn't keep anything down. It was really bad. They just started telling me to hold my stomach, and I started pushing really deep. And so now anytime I hate throwing up, I don't like that. And I don't want that to ever happen. I hate it. Happened a month ago. But I just will, but sometimes you can't stop it. And having incision, it would just hurt so bad, you guys. Oh, anyway. So all that drama and legit abuse, I have PTSD. I do. being in a hospital infection, scary. But I was discharged the day that the culture results came in, and they did not read it at all. It wasn't run stat. They claimed they didn't see it. It came in at 9 in the morning. They discharged me at 12, and they gave me the wrong antibiotic. They gave me an antibiotic that was penicillin based. It was penicillin resistant. And then they called me 5 days later, yelling at me again and saying I needed Zyvox, and if I didn't, my insurance wouldn't cover it. The CDC was going to come out and get me, basically. And my mom was like, hey, why didn't you? The hospital couldn't afford it. That's why they just discharged me. Real nice. Yeah. So I was definitely verbally and physically abused at the hospital. And on the phone, saying like the CDC is going to come after me if I don't spend $4,000 for Zyvox. And for my mother, she said the hospital couldn't afford it, and that's why they discharged me. I'm not sure the details. I didn't hear that conversation, but that's what she said. And she was able to get some of the medical bills reduced. We had huge bills after. But anyway, I remember the misery of being in that hospital. No food. One of the worst things is like when you're not eating anything, especially I could taste the antibiotics and smelling it. But when they would flush the IV, just like I'd feel like I couldn't breathe and just horrible feeling in my head. It's the worst. Oh, like I watched a woman again. It's not as bad as someone going through cancer, right, and chemotherapy, but she complained about that. I was like, right, it is awful. It's horrible. She's like, oh, I hate it when they flush it. And the chemo was awful too, but there's just something awful about it, especially when you're in a hospital for a week, not eating anything. I had nothing to eat. I had some juice. I remember the first meal I got was literally after I was discharged. They brought me some food. I remember eating that and I hadn't eaten any food in 6 days. I'd gotten some juice on Thursday, Friday. I was throwing it up. And my mom was like, why didn't you give her a TPN? Hey, if you're going to refuse to give her food, it just really was scary. But in the midst of it, you guys, I really remember, I have a point here, feeling a voice, the Holy Spirit, saying, I didn't want this to happen to you. And thinking of everything, me listening to the Spirit, I couldn't get them to listen to me. I think an angel was holding me down from going and having a tech try to suck all these internal abscesses out of me. It's in my medical records that he was trying to get that done too. I'm going to show it. I have witnesses. My mom was there. I have recordings, you guys. But God cared about me, and it wasn't supposed to happen. And as I look back, if I'd been able to get people to listen to the truth of the Spirit talking to me, I'm not a doctor, right? But like if they listened, one of them was they refused antibiotics, and they refused to test me for an infection, my blood or urine, the first time. They all refused 2 weeks before this, because this was the 17th I got admitted, got discharged on the 24th. It all started on the 30th, guys. I'm lucky to be alive, and God intervened, and I survived. And he didn't stop this from happening. That hospital shut down. And hospitals are a miserable place in general. But this hospital, I'll say it was Gilbert Hospital. It's shut down. It's gone. They've named it something else. But it was on Power Road. And it was the worst. Sure enough, they were shut down. I think I'd have to look it up, but it was like on the date that I was readmitted when it became even worse nightmare. It was like almost symbolic in a way when they got shut down. And I would just look them up every so often. And I don't know if the bigger hospital would have been a lot better. They probably would have been, but they'd refused a CT scan. It wasn't right. It was very, very scary. But yeah, thank you. Thanks for listening, you guys.